Ugandans living with life-threatening conditions, including cancer, sickle cells, diabetes, and other chronic illnesses, face significant challenges such as poverty, limited knowledge of diseases, and inadequate access to healthcare services. These factors often contribute to high mortality rates among patients. In response, Hospice Africa Uganda introduced the palliative care approach to improve the quality of life for patients and their families during serious illnesses.
We have to do a lot of advocacy for people to understand what palliative care is, because one of the things that is hindering palliative care is the misconception, because most people think palliative care is for the dying, and that is something that we are trying to demystify and correct. That palliative care should start from diagnosis.
Nachanja explained that palliative care is not limited to cancer alone, as many in the community believe.
Palliative care is for everybody with a life-limiting illness, non-communicable diseases. This includes sickle cells, diabetes. We have people, all people in our program are not only cancer. We have sickle cells, we have diabetes, and all other non-communicable.
As part of expanding support for patients, 30 Irish volunteers raised over €100,000 through a fundraising initiative drive to assist Hospice Africa Uganda in its mission.
We drove vehicles from Dar es Salaam to Kampala as volunteers, and we used this opportunity because it's an adventure program that we were doing. We used the opportunity to collect funding for Hospice Africa. But we know that there's a lot of struggle in Uganda, and we've seen that, and the poor people particularly, they don't have access to healthcare. So we want to contribute a little bit of that going forward.
Hospice Africa Uganda expressed gratitude for the Irish support, noting that the funds will help in expanding services across the country.
This contribution or this donation that has been given to us is going to go a long way into bridging our budget gap for the financial year 2024-2025, and also support most of the activities that we are doing, because we had cut down on the activities that we are doing because of funding.
Wonderful to have you here and to see you. And we've been watching what you've been doing through Miriam, since you came from Dar. It's just amazing. Honestly, we're so grateful to every single one of you for that.
Hospice Africa Uganda's dedicated health workers ensure that over 1,000 patients receive care each month, providing a pain-free, dignified end of life.
Between about 500 to 1,000 patients within a month. And over the course of the lifetime of the organization, which is about 31 years now, Hospice has seen about 39 to 40 now. 39 to 40,000 patients.
And the very fortunate part of it in the life of the patients and us who take care of them, even when they're at their end of life, they say we want to go and have a meal with our friends.
Rebecca Nantongo, Susan Inabugude, UBC News.